Earlier in 2019, there was a lot of femicide, girls being killed by their boyfriends because they did one or two things. There are also cultures of, if there's violence in terms of a marital relationship, that is fine. If there's a marital rape, that is fine. So you find such situations being normalized and it being also a taboo to speak about those issues.
The 2030 Agenda for Sustainable Development is grounded in respect for human rights and the power of people to change the world. Every individual on the planet has the right to health and well-being in all aspects of their sexuality, their body, and their reproductive choices. Ensuring these rights is integral to addressing poverty, education, violence against women, and gender equality. Sexual and reproductive health rights are agreed in international law. They were fought for by courageous women's rights activists and advocates across a broad range of professional fields and frontline experiences by movements of all ages, levels, and backgrounds. They are still being fought for. While progress has been made globally, many barriers remain, especially for those most marginalized, excluded, or discriminated against. Human rights are central to delivering the 17 Sustainable Development Goals in the Sustainable Development Agenda. Indeed, each SDG target is simultaneously a metric and a claim for human rights. The interplay between these political commitments and human rights obligations is particularly important when it comes to achieving sexual and reproductive health rights. For decades, human rights-based tactics have been used to drive progress. In this episode of Right to a Better World, experts share challenges they have faced and tactics they have used to address them. The challenges they describe occur in settings all around the world. The strategies used are ones that they have found to be successful in their own settings. Viewers are encouraged to learn from these experiences and consider how tactics could be adapted to their own contexts. When sexual and reproductive health begins with equality, the discussions, decisions, programs, and policies which follow can build towards a future where every individual is not only born free, but lives free and equal in dignity and rights without violence or discrimination. The time to take action is now. Violence against women is any act that results in or is likely to result in physical, sexual, or psychological harm or suffering to women. This includes threats of such acts, coercion, or arbitrary deprivation of liberty in public or private life. It happens everywhere, in every country, in the home, in communities, at work, and at school. Crises, including health and humanitarian crises, frequently contribute to higher rates of violence against women. Violence against women is directed at women because of their status as women. The consequences are dire, jeopardizing women's health, including sexual and reproductive health and mental health, hampering their ability to participate fully in society, causing tremendous physical and psychological suffering for both women and their children. The majority of women survivors of violence do not disclose or seek any type of services. Efforts to address violence against women must recognize the many different contexts in which it occurs and the many different forms it can take. The majority of violence against women is committed by an intimate partner, her current or previous boyfriend or husband. Globally, around 30% of women have experienced physical and or sexual violence by an intimate partner in their lifetime. This increases the risk of acquiring an STI or in some regions HIV by 1.5-fold.
When a woman is experiencing violence, especially from her partner, she's really unable to keep safe from HIV. Men have power to decide how, when, and where sex should be done. And the woman is at risk of being infected because she cannot say no.
Schools are another setting where violence against girls can take place. Assault and harassment during their commute, bullying, sexual harassment, and mental or physical abuse on school property are all challenges across various country contexts. This has a direct impact on girls' access to inclusive, quality education, a target of SDG 4, and an indirect impact on many of their other human rights.
Young girls are taken advantage of at a very young age, and they do not understand the choices and the avenues whereby they can exercise their rights when it comes to sexual and reproductive health and rights. And so you find a lot of dropouts and a lot of girls also going through a lot of traumatic experiences that would be avoided if they had guidance.
Promoting a safe and secure working environment for all is a cornerstone of SDG 8. This includes a workplace free from sexual harassment and violence. But for many women, especially women migrant workers and others in precarious employment, this is far from reality.
So we went to Naivasha, which is a flower farm, and we've met the informal workers, the casual laborers working for the flower farms. When, for example, the sexual violence cases are reported, companies don't take them very seriously.
A wide range of tactics have been used to prevent and address violence against women and girls, and to recognise it as a fundamental violation of human rights. Prevention of intimate partner violence is possible when interventions are informed by evidence of what works.
We started out by describing the problem. We've now moved to research on what works. What are the kinds of interventions that are successful, both for preventing the problem from happening in the first place and also from interventions to respond.
The Respect Women framework on preventing violence against women, developed by the WHO, UN Women, OHCHR, and other international agencies, promotes 7 strategies which focus on relationship skill strengthening, empowerment of women, services for health, justice, police and social sector, poverty reduction, environments made safer, including schools, workplaces and public spaces, child and adolescent abuse prevented, and transformation of gender attitudes, beliefs and norms. This action-oriented framework can enable policymakers and health implementers to design, plan, implement, monitor and evaluate interventions and programs to prevent violence against women.
We have come a long way for sure. We still have some ways to go and we need to do more to stop this violence from happening in the first place. This involves addressing the social norms that still prevail in many settings that make this form of violence acceptable.
Women are not exposed to gender-based violence by accident or because of an inbuilt vulnerability. Violence against women is rooted in discriminatory social norms and power dynamics. Dismantling these underlying causes of violence against women and girls is at the heart of achieving gender equality and empowering all women and girls, as set out in the targets and indicators of SDG 5, ensuring healthy lives in SDG 3, and reducing inequalities in SDG 10.
Women and men are valued differently. Society has heaped privileges on the men, while the women are looked at as subordinate. Power is not only the problem, but also the solution to preventing violence against women. We are making it personal. Everyone connects with power. Every day, people are living with power or grappling with power. They find themselves within this whole conversation. If you're working to create norm change, there has to be change at all levels.
Strategies to raise awareness in communities about violence against women and girls are critical, as there is still a lot of stigma and shame which inhibits many women and girls from talking about it.
Intervention is like a big, complicated word. Sometimes it's just about talking, about dialogue. I mean, the fact that we went into schools and just began a conversation with parents, bringing them together in the school along with the school personnel, and then having the conversation start from there. And we also sort of train providers within schools to appropriately refer children to health facilities for care. What we found was that this dialogue began to spark other conversations in the community. I guess they just felt that, oh, it's actually okay to talk about this openly, rather than pretend that nothing is going on.
SASA is a community mobilization approach to prevent violence against women and HIV and AIDS. It is activist-led. It's not workshop-heavy based. It comes away from the traditional programming of organizations going to do things themselves. Instead, they support activists who do the activities with their friends and neighbors.
Health systems play a critical role in responding to violence, wherever it occurs. Supporting health workers to respond appropriately to violence, as well as ensuring their work environment enables them to provide safe, effective and quality survivor-centred care, are important strategies for better addressing violence against women and girls.
نو په هغه اساس باندې مخکې له دې چې موږ جی وي بي ټریننګونو ته ورشو دومره معلومات یا آګاهي په دې باره کې نه درلودله اما وروسته د جی وي بي د ټریننګونو نه اوس یو تعداد مسایل موږ کوی شو چې په ښه دقیق او صحیح صورت سره هغه وپېژنو لکه متضرر محورونه لکه د محرمیت اهمیت مسلک هم داسې د طبابت د چون دا واقعیاتو سره موږ ډېر سر و کار لرو نو اوس کولی شو چې د جی وي بي واقعیات وپېژنو او تشخیص وکړو.
We came to learn not to ask direct questions, not to give our opinion or our judgment on them, and let her speak. And once that flow starts, once that connection is established, that doctor-patient relationship emotionally is established, she will actually tell you the whole history.
Legal frameworks to promote, enforce and monitor equality and non-discrimination on the basis of sex are an important SDG 5 indicator. But putting laws in place does not automatically make them effective.
There are existing protections for women in the workplace or for individuals in the workplace in relation to harassment, but we know from our call for evidence that they are not actually addressing the problem. The recommendations that we developed included government implementing a mandatory duty for employers to take preventative steps to address harassment in the workplace. So what we would like to see is government implement a much stronger legislative duty.
It has taken decades of struggle by the women's rights movement to persuade the international community to view violence against women as a human rights concern and a sustainable development priority, not a private matter. Governments have obligations to respect, protect, and fulfill the right to a life free of violence and to provide for sanctions when they fail. When seeking accountability, the priority consideration must always be the safety and well-being of survivors, respecting their wishes and autonomy and supporting them to make informed choices about the type of justice they want. Context is vitally important. There are many strategies to hold perpetrators accountable, including strategic litigation and public campaigns.
When the teachers impregnate the girls, that means the system has failed. And okay, what they do is they blacklist the teachers and they are always removed from the payroll. But we think that is not enough. The case that was quite interesting is where one of the judges, she did find a ruling against the Teacher Service Commission, the commission that is responsible for hiring teachers, asking them that they must take responsibility. And they were ordered to pay compensation to the girls who had gotten pregnant while in school.
The Justice for Liz issue came about a few years back when a young girl was raped. And the punishment for her being raped was that she was gang raped and her rapists were told to slash grass. Feminist organizations and young women organizations came back to the police and the police commissioner to ask and request that the people who are found to be perpetrators should be punished according to our constitution and according to the laws of the land. And there was a very big campaign to get better justice. So consequently, they were jailed, but also it was a sign that the police system had to be checked in terms of when someone reports a case, any case of violence, what happens and how is it followed through.
The Maria Peña case is another example of litigation that became a political mobilizer. So this was a case from the Inter-American Commission that really galvanized a change in public policy, a huge change, because it was a case that addressed gender-based violence, intimate partner violence. It called on responsibility of Brazil also for not having prevented this kind of violence. The reality of a case that says you have the right to not be bruised, you have the right to be free of physical, psychological violence, it's powerful. It can change women's lives.
Investing in autonomous women's movements has been one of the most important drivers of changes in laws and policies to address violence against women over the past 40 years, according to data from over 70 countries. Women organising to advance women's status define the very concept of violence against women, raised awareness of the issue, and put it on national and global policy agendas.
Often, we thought that it takes generations or centuries to change. Working intensely with the communities, we can actually see change coming.
Violence against women and girls is a violation of fundamental human rights. to life and to physical and psychological integrity, not to be tortured or treated in an inhuman and degrading way, to respect for private and family life, and the right not to be discriminated against. This understanding is more than theoretical. Human rights-based tactics can offer a practical route to addressing systemic challenges across all the circumstances where violence against women and girls occurs, including but not limited to at the hands of their partners, at school and in the workplace, by using evidence-informed prevention strategies, addressing power relations and social norms, community mobilizing and dialogue, supporting health systems and professionals, putting in place strong legal frameworks, accessing justice and ending impunity, feminist organizing and mobilizing. Every individual can help to deliver the 2030 Agenda for Sustainable Development, building a world in which women and girls are free from all forms of violence and discrimination.